First of all, I want to thank you all for all your work that you're doing. The thing about living in the United States is that the whole world is looking at us and drawing either inspiration or becoming depressed about what we're able to accomplish. So even though we're just a little over 300 million people, the whole world is looking at us. And just a little bit about my background. I'm a native Texan. I come from an area that unfortunately is called Cancer Alley, which extends from Houston, Texas to Baton Rouge. And my formative experiences growing up in Texas in a segregated community completely with a very strong Ku Klux Klan, where the schools were segregated, the restaurants were segregated, the neighborhoods were segregated, where black people literally couldn't cross the railroad tracks from the ghetto after dark unless they wanted to be assaulted by white racists or arrested by the police. And the situation down there, Port Arthur, Texas, where I grew up, is an oil refinery town. I mean, originally, it's a beautiful wetland, incredible birds and wildlife and the Gulf of Mexico. I remember when I was a kid, we could just throw a seine right off the jetty and pull in shrimp, and you could catch as many crabs as you wanted, fill up bushel baskets. But as I grew up, and as the oil companies and chemical companies polluted more and more, I watched right in front of my eyes the destruction of this environment. My experiences with the medical profession were pretty revealing to me right off the bat. Health Liberty, I had, unfortunately, my mom died when I was 5 years old when she committed suicide. She had been misdiagnosed after it's postpartum depression is what she had, but they said she had schizophrenia and they prescribed some incredibly powerful drugs like Thorazine and stuff like that. And so she shocked everyone in our town by committing suicide. And so my dad remarried about a year later to a woman who, a well-intentioned woman, but she had had a very hard life. And she worked for some doctors. And so she got pregnant with one of my stepsisters, and the doctors told her that morning sickness she was having could be alleviated with this new miracle drug called thalidomide. And so my little sister was born with deformed fingers, and toes. And then, about that same time, I got a disease called ringworms, and again, my stepmother who worked for a doctor. They were very concerned about this kid who had ringworms on my head and my skin and so on. And so they decided, well, they didn't really know about ringworms, but maybe if they sent me to the cancer hospitals for intensive X-ray treatment, that this would be a way to have an innovative new cure. So they dragged me into these cancer hospitals, I remember in Galveston and Houston, and they put me in these little booths, and they pulled back the lead curtain, and they'd zap me, And it's like, I was terrified, and I just thought, these people are totally crazy, or something is crazy here. So the X-ray treatment successfully made all my hair fall out. So I was bald-headed, when I was 5 and 6 years old, and you know, that's how I learned how to fight, because the bullies used to knock my sailor cap off so they could laugh at me. And I was a freak, you know, in the school, the only ball-headed 6-year-old in Southeast Texas, I think. So I learned how to, though, when the bullies touched my cap, I learned how to fight back. So my experience was also this whole thing of environmental justice and stuff. It was like, I started noticing, I mean, one of my favorite cousins, I watched her die, you know, with cancer when she was like 12 years old. I used to go over to her house. You know, it was just the saddest thing. Cappy was what her name was. And, you know, it just seemed weird. This young person is like dying of this cancer, you know? And then, as I grew up, I mean, you got to go to Port Arthur to believe the air, the fracking type situation now. I mean, 24/7 flaring off natural gas, you know, 24/7, the oil rigs pumping, the air stinks, you know, but the workers, you know, you made good money, you know, and you didn't have to have a college education to work in the oil refineries. But people started getting sick, you know, all over the place. And later, I picked up the New York Times one day. I was reading this article about my high school, you know, and it said it had the highest, at that time, 34 people out of my high school graduating class had died of cancer, you know, and this was over 20 years ago. And then I went back to a high school reunion, and most of the women had hysterectomies before they were 30 years old. Birth defects, cancer, I mean, and I became really angry about all this. You know, I didn't understand, why do people put up with stuff like this? You know, and why isn't there a way to fight back? And then as I got a little older, the oil companies gradually took over, got a stranglehold on the politics of Texas, you know. And by the time I was graduated from high school, you know, Lyndon Johnson and his band of criminals had taken over the whole country, you know. And so I grew up in the shadow of the oil and chemical barons, and I really saw parts of life in America that made me a little rebel. You know, I was pretty darn rebellious by the time I got to high school, you know, and I was mad, you know, about this situation. So, but thank goodness, my grandparents, who were Cajuns from Southwest Louisiana, had moved, like so many Cajuns, small farmers, poor people. They moved to Southeast Texas because there were a lot of jobs, you know, in the oil refineries. Oil was discovered there in 1901. But they had a family farm in Southeast Texas, in what's called the Big Thicket area. And their family farm was pretty amazing. It was an organic farm, but they didn't know the word organic. But I never saw a chemical on that farm, never saw pesticides. And the other thing about them, they never went to the grocery store, you know. It's like I only remember a couple of times buying bird feed, you know, with my grandma at the grocery store. And because they and their neighbors grew everything, you know, and if you didn't grow something, you traded with, you know, Mr. Smith down the road. That was actually his name. So it was a pretty, you know, even though I had some hard times, every weekend I got to go to the farm, and every summer I got to spend in the farm. you know, and they had every kind of animal. I can still remember the names of the cows we milked. You know, we would name them by the months they were born in. So I remember January and September. You know, I can still see these cows, you know. And I loved them, and I loved the goats. And I had, you know, my duties on the farm there, but it was fun, you know. So I knew from an early age that there was an alternative, you know. And I mean, I still had a great, my father and stepmother are dead, but my sisters and my brother and I, we had a tight group, and all of our cousins and so on. But I had that farm, you know. And then politically, my grandfather, my Cajun grandfather, he's a pretty darn interesting guy. He only went to the 2nd grade because he was poor, but he had taught himself how to read, and he was an amazing guy. My grandmother had gone to the 6th grade. But I remember in 1955, I was 9 years old, and we were visiting relatives in Louisiana, and my grandfather took me to the state capitol in Baton Rouge, and he took me to it's an impressive building there, where the state legislature would have their sessions, and he took me behind the podium. It was a marble wall. There were bullet holes in the wall, you know. And he stuck my fingers in the bullet holes, and he said, "This is where they took down Huey Long in 1935. Huey Long was the governor. He was a populist governor of Louisiana. And my grandfather said Rockefeller's gunmen took him down, and they actually killed him while he was speaking to the state senators." And I said, well, Papa, I said, why did Rockefeller's gunmen kill Huey Long? And he said, because Huey was standing up for the poor people, and he was trying to get black people, you know, and the poor whites together. And Rockefeller's gunmen took him down, you know. So that kind of got me thinking, and those were my formative experiences. So that's a long introduction to where I've come from. By the time I was 21, I had gotten involved with the farm workers in Texas who were trying to organize farm worker unions down in the valley. And I had been on picket lines and, you know, had rocks thrown at me by the Klansmen and the police and so on and so forth. So I became an activist. I decided that I would, you know, dedicate my life to try to make a better world. And it's been a long road, but I must say I'm very happy to still be alive, not in prison, and not dead of the cancer epidemic that has struck down most of my high school, you know, buddies and friends. So here we are. Here we are in the United States right now. And I mean, we're facing, as you know, some pretty serious problems. We've got, you know, a climate crisis that our children and grandchildren are going to have a very hard time just surviving, period. We got a health crisis now. I mean, like the movie said last night, I mean, 1 million kids with autism, and, you know, I mean, that's just the beginning of the childhood diseases that are out there. And if it's really true that 1 out of every 2 kids is going to have autism spectrum, you know, type disease by 2032, I mean, it is going to cost trillions of dollars. I mean, we're not going to survive this, you know. We're not going to survive this, you know. And we've got a political crisis where, you know, I mean, we were all taught that, you know, democracy is, you know, the best system and you have to participate in that. But the thing is, if the body politic is so severely damaged, you know, psychologically and physically, how do you have a democracy, you know? And then, of course, we have these clusters, these elites that really run this country. I mean, who runs the country? I'm going to talk more tonight about natural health and the food movement, but who runs the United States? Well, I think most people would agree, it's the fossil fuel industry, it's the military-industrial complex, it's the Wall Street financiers, it's big pharma, you know, and it's big agriculture. Yeah. Okay, these are 5 incredibly powerful groups who apparently are willing to take us over the cliff rather than sacrifice short-term profits. And so the way I always see it is it's either them or us, you know. And so how do we take them down? It's been my burning passion. And I think one thing you notice in this country is like people do care, you know, about some things. Everyone cares about something. You know, maybe it's just their kids, maybe it's their grandkids, you know, maybe it's the songbirds, maybe it's, you know, poor people that the Bible or another religious tradition tells you that you're supposed to help take care of and whatever. But what I've noticed over all these years of activism is there's 5 issues, really, that people care about, you know, if they start to become activists. One of them is health. One of them is justice. You know, one of them is sustainability, or what I prefer to call regeneration now. One of them is peace, and one of them is democracy. Now, when you think about all the activists you know, they pretty much, they have a primary passion. Health, justice, sustainability, peace, or democracy, you know? And they care about this, okay? And the problem is that we're facing these 5 groups who are very powerful, who are united when it comes to buying politicians, controlling the mass media, brainwashing children and students in schools, starting wars, you know, cracking down when we get too strong. So how do we get people who are in these silos, it's called, you know, where they're trying to do their best, you know, where they think that that issue that they're most concerned about is the most important issue? How do we get people working together, you know, in synergy? So a few years ago, about 10 years ago, some of us started to notice that the organic consumer movement was starting to get big. Millions of people, billions of dollars. But a peculiar thing we noticed about the organic consumer movement was that a lot of them still depended totally on industrial medicine, you know? It's just like they weren't even aware of natural health practices and so on and so forth. They were concerned about the food they were eating, but they went off and just did what the doctor told them, or what Big Pharma told them. And so my discovery of the natural health movement as a political force, I think it was in '94 when I worked on the DSHEA thing, the Dietary Health and Supplements Act, where we helped retail stores and the customers in retail stores mobilize around these things. And so I saw the incredible power. If you get natural health people and natural food consumers or organic consumers working together with businesses, you know, because it was all these natural food stores and vitamin stores that allowed us to set up petition gathering in their stores, that wrote about it in the newsletter. It was a powerful force. So, but what I noticed a lot about the people in the natural health movement back then was that they weren't eating organic food, a lot of them. They would take the supplements, but they didn't understand that food is the best medicine, So we got these two large groups. It's 100 million people now in the United States who occasionally or regularly buy organic food. Okay, 100 million people. We also have about 100 million people who take supplements or visit alternative practitioners, and this is the majority of the population. And yet, why aren't we more powerful? Okay. And then you've got a lot of people like, we get these other issue areas, It's just like the Black Lives Matter. It's an important movement in Minnesota now because the police keep killing young black men, especially, and harassing them on the streets and so on and so forth. And so justice to a lot of people, especially young people, especially my son's, who's 18, his generation, they're more concerned about justice, racial justice, economic justice. They really are concerned about this, how gay people, lesbian people have, until recently been considered second-class citizens, and so on. People aren't as concerned about the war as they were when I was growing up, but I noticed the military is still spending $1 trillion a year, And when we talk to them about things like health care, or how come we eat garbage, most people, well, there's no money for that. Well, there's no money for that because we already spent it on the 800 overseas bases and the endless wars. And yeah, we can kill people now with drones, and we don't draft people. But there still are a lot of people who care about peace, And there's a lot of people who care about democracy. I mean, so many people tell me, well, Ronnie, the reason why the organic food is not the norm, and the reason why Big Pharma controls the healthcare system is because of campaign finance reform. If you don't fix campaign finance reform and have good government, you can't solve these other problems. And I mean, there's definitely something to that, but you didn't want me to come up here and talk about campaign finance reform. People don't wake up in the morning thinking about campaign finance reform. And so we got these silos, we got good people, but we're divided. I mean, all these insane divisions. One of the most important, I believe, is certain people call themselves progressives, which is just, I remember when that word started being used in the late 70s, early 80s. Progressive is just, that's a radical who wants to pretend to be, more acceptable, but I never have liked that term. Progressive, it's like, it's wimpy, and I think it's offensive to people like rednecks, like where I grew up. Progressive. I mean, would you walk into a bar in Port Arthur, Texas, or Lafayette, Louisiana, with a shirt that said, I'm a progressive? I mean, what's wrong with the old-fashioned term that my grandfather's generation used, populist, for the people, It's like, I don't know. But here we've got populist progressive, right? These people don't like each other, and they're not working together. And so you got the Trump phenomenon, the Republican Party overthrowing the Republican establishment. You got Bernie's people overthrowing the corporate liberal, the Cadillac, limousine liberals is what I call them. But yet, they're not talking. Progressives and populists aren't talking. Okay? Another divide that I think is extremely serious is religion, you know? I mean, you got the churchgoers, you know, and then you have the people who don't go to church. You know, and it's just like the churchgoers often think that these atheists, agnostics, you know, Mother Earth worshipers, whatever you want to call it, are, you know, that's not who they want to talk to that much, work to that much. And then a lot of people in my generation and younger generation, like even my son, you know, he's got a really bad impression of organized religion. Because he said, Daddy, I mean, all I've ever seen is hypocrisy. These people talk one thing, but they do something else, you know? And so we have to, and of course the racial divides, you know, are incredible. You know, I mean, in Minneapolis, St. Paul, where I lived part of the time, there's a lot of antagonism still between blacks and whites, but there's even more antagonism. This is politically incorrect to say this, but the Latinos and the blacks, lots of tension, you know. The people recently from Africa versus the people who were, you know, brought over here as slaves, you know. I mean, the Hmong people, the Somalians, you know, there's so many different groups, you know, and we've got to rise above this somehow. And I think food and health are a good start, okay? But we need to acknowledge these other purple passions that people have. And my belief is you work with people. I don't care if your primary concern is peace or justice or democracy, you know, or health or sustainability. It doesn't matter to me what your primary concern is. If you are a little bit concerned about my primary concern, we can work together, you know. And I don't care whether you're, you know, whether you have 15 guns in your closet, you know, and body armor and whatever, because you think you're going to have to fight for your freedom down the road, or whether you think guns are an abomination, you know, and we should all, you know, make a peaceful revolution totally. You know, hope we can have that. But 70 million people have guns in this country. And, you know, they're going to shoot me if I don't learn how to talk to them. You know, and part of what you have to be able to talk to people about is, well, why do you have all those guns? You know, and there's usually a pretty good reason that people think this. So, how do we create the synergy we need now? I think that the food movement, which encompasses health and sustainability, and the natural health movement, I think we have a lot in common. And I think these two movements can start to work together. And what I've seen in the food movement the last 5 years is that once we joined hands with the natural health movement, with groups like Mercola, with groups like the National Vaccine Information Center, the Fluoride Action Network, the Toxic Teeth Campaign, or the Get Mercury Out of Dental, the Alliance for Health, the National Health Freedom Coalition, is that we're a lot more powerful, you know. And if we will start to think that way, I think we can get even a lot more powerful. But we have to start thinking in terms of, there's no one that's going to help us, you know, dismantle the oligarchy and build a new world. It's us. You know, and it's scary stuff. Because when you go up against these people and really threaten them, they will take you out. And Karen Silkwood, who was from my community, they took her out. You know, when she discovered this missing uranium from the nuclear processing plants, She was going to a meeting with the New York Times, and a car rammed her from behind and killed her. You know, and I saw other people in Texas, you know, be killed once they became affected. And Texas is a little more brutal in some ways, perhaps, than a lot of the country. But this is for real. This is life or death. And we have to proceed ahead now, thinking strategically, I believe. Okay, I think there's several components of creating this grand synergy that are real important. And one of them is the message. You know, we need to spend a whole lot of time thinking about not just what we're, you know, what we want, natural health, for example, but how to explain it to people. And we need to use language that touches people's heart, you know, primarily as it touches their head, too. And it really matters the way you talk about things, your style of delivery, you know, your ability to adjust to who you're talking to. If you're talking to a Christian, you know, you better be aware of that, you know, and you better think about the way you express yourself, you know. If you're, I remember when I was speaking in Atlanta last year, right after the Nation of Islam, you know, and it really made me think. And I also knew that Robert Kennedy was coming on after me, so I made sure I talked about things like the Kennedy assassination and, you know, how I came out of Ku Klux Klan territory and so on and so forth. You have to think it's not just the truth, it's how you talk about it, you know. So, and you know, we live in a society where the body politic, these are damaged goods, you know, and I'm sure you've noticed. But we got a lot of people who are in repressing things. They don't want to think about things like climate change and, you know, drones, you know, killing people. And how come Muslim people think we're really pretty bad government, you know, and so on and so forth. So let's hone our messages. Let's talk about things like, in the food movement, talking about, do you know what's in your food? And do you know who's lacing your food, you know, with GMOs and pesticides and animal drugs and sewage, sludge, and, you know, antibiotics and so on. Well, I think that's a good frame for the vaccines thing. It's like, how come they don't want us to know what the vaccines are? How come they don't want us to know what the side effects are? You know, aren't they supposed to tell you in every doctor's office or every clinic? They're supposed to have posted, you know, the side effects of these vaccines. They were forced to do that, but they're not doing it. And, you know, so this right to know, right to choose, this is really solid ground to work on. The message is all important, you know. And when someone comes up with something like the Occupy movement, you know, this whole thing of the 1% and the 99%, that really resonated, you know, with a lot of people, you know. And, you know, Bernie's political revolution thing. Bernie's got his head on backwards when it comes to natural health.
And
vaccines. And what?
Vaccines.
Definitely. And we tried to pressure him about that in meetings, his staff, and ask him, and he's ignorant. He's ignorant about natural health, you know. And he's great at calling out, you know, corporate corruption, but he didn't notice that Big Pharma has got their, you know, their paws everywhere. All right, besides the message, the messenger is just as important as the message. It's like we have to be very careful about who is delivering our message. You know, if you're going to speak to a bunch of hunters and gun owners, you know, you should be able to relate to what they're talking about. You know, you need to be able to understand that. I mean, how come some people care more about wildlife and birds, you know, than they do about people? You know, because we have a lot of people in this country who are like that. You know, and you have to be able to empathize a little bit with, you know, something made them like that. You know, I mean, I love birds and animals too. So the messenger is extremely important. It's extremely important that Farrakhan and the Nation of Islam are very much aware of the vaccine issue. You know, that the Somalian community in Minneapolis is, you know, could be a powerful force, you know, around this. So the message, the messenger, and then the amplification of the message. You know, it really doesn't matter if we're telling the truth about these issues unless ordinary people hear them over and over and over and over again. I think Mercola has taught me, Mercola.com, in their newsletter, a good lesson about that, which is just because you've written about something before doesn't mean you should come back to that and try to write about it again, tweaking it a little bit. But unless people hear something numerous times, they do not get it. And they have to hear from it through numerous media. You know, it's one thing, yeah, they read something on the internet, but until they hear it from a friend or a neighbor or a relative, or they're one of their kids or grandkids, it doesn't sink in, you know, as much as it should. And the amplification is we live in a society dominated by mass media, and we don't control the corporate mass media, and we're not going to control the corporate mass media, and they're not going to change the corporate mass media. That's all there is to it. I mean, I've beat my head against the wall for 50 years, and yeah, you get a little bit of your message in the corporate mass media, but they always distort it, you know? And we have to just build our own media, you know? And like Robert today, the alternative media here, Robert Bell Scott. It's just like, we have got to take this very, very, very seriously. Rose and I built up Organic Consumers Association from an email list of 600 people to 1 million people now, and 2 million people on our Facebook pages. And we did this very consciously. It's taken 18 years, but what we realized is that if you don't reach a mass audience, you know, and you don't communicate to them the best way you can. I mean, everything we put out, we edit and re-edit over and over again. Every image we put out is carefully selected. Every headline we use, every article. We have 200,000 articles archived on our websites. I picked out every one of those articles just about over the last 20 years. You know, I looked at 1 million or a couple million articles, and I selected a couple 100,000 that seemed to be relevant, you know, and they're archived, you know, on our site. But it's like, this was very conscious, you know, and this is how you raise money also. There's a direct correlation between the size of your audience and the resonance of your message and your ability to raise money. I mean, Organic Consumers Association, you know, we raise you know, $3 or $4 million a year, but we raise it from the people, you know. This is 40,000 people in our network, give us 25 to 100 bucks a year. That's basically, we have two companies that give us money, Dr. Mercola and Dr. Browning. That's it. You know, we don't have anything other than our audience, and our audience is passionate support, you know, and there's no shortcuts to this. But then you realize, I mean, we're a drop in the bucket, you know, OCA, in terms of the population. So that's when we started seriously looking around at who are the other mass communicators who are saying similar things. How do we get into an alliance with them? And so this ballot initiative stuff for labeling genetically engineered foods, which, you know, we worked on hard. You know, I mean, we worked with groups who had 25 million people total on their email list. I mean, we were just 4% of the communication, and there's some overlap, and 35 million people on our Facebook pages, you know. And this took work, you know. It's like a lot of people in the movement have personality disorders, as you probably noticed. And it's nearly impossible to achieve unity between large numbers of groups, even if you're the natural health movement or you're the organic movement. And so one thing we have to cultivate is this ability to avoid the people with the personality disorders and find the people, well, I call them live wires. Find the people who are more broad-minded, who are more cooperative. Maybe they're not the director, but maybe they're the media person or the social media person or whatever. They're out there. The live wires are out there. I think we were together in a previous lifetime. That's my belief. And we have this interplanetary solidarity going on too. And the reason we're here today is that we resonate with one another, right? So pay attention to this. This is, you know, it's kind of humorous, but it's not humorous in the sense that we've got a divided, disjointed movement of, you know, we've got thousands and thousands of public interest groups in the United States that are underfunded, that don't have big enough audiences, you know, where the top activists are overworked and burnout and so on and so forth. And I think the solution to this is find those people with a sense of humor, you know. Find those people who have that gleam in their eye, you know. Find those people who are joyful about making this revolution, this consumer revolution that we're talking about, and figure out how to work with them, you know. And but let's set our sights on, let's really raise our sights. I helped raise, over the last 4 years, $40 million, you know, for these ballot initiatives and stuff. You know, we spent it all fighting the bad guys. They spent $400 million, you know, and they discredited themselves. They beat us, the Dark Act, you know, Obama signed that, you know, last week. 22 years of my life I've spent on right to know, right to boycott things, and with one sweep of the pen, you know, with the mass media repeating, oh yeah, now there's national labeling, you know, except it's not labeling, you know, it's national no labeling is what we got, you know. QR codes, 1-800 numbers, sometime down the road, from food corporations who have been poisoning us for the last 50 years, who could care less about the fact that 48% of you know, women get cancer now in America. 38% of men. You know, skyrocketing. These people don't care. You know, I mean, maybe they care in their soul of souls, but their everyday life is to maximize short-term profits. You know, and so the message, the messenger, the amplification of the message. If we'll just keep these things in mind and realize even the natural health movement, you know, and the organic food movement coming together, this is not enough, you know, in this country. I mean, it's like, how come organic and grass-fed and non-GMO, how come we're just 10% of the food supply after spending decades working at this? It's like, well, one of the reasons is poor people, you know, spend 30% of their income, the bottom 20% of our economic percentile. They spend 30 to 50% of their income on food. You know, whereas the average household in the country spends about 10%. Okay? So you look at all these polls, how come poor people and black people, they seem to understand genetic engineering and this stuff better than the white people, you know? Poor people know the difference between terrible junk food and good food, you know? They don't have any money to buy it, you know? And so that's why I've been so happy to see the organic movement embrace in the last year and a half this $15 minimum wage, you know? It's like, we got 20 million people working in the food chain in America. 20 million people. This is all the way from the farm workers, to the small farmers, to the people who are the retail clerks, the people who drive the trucks, the people who stack the food in the warehouses, the people who cook the food in the restaurants, wash the dishes. You know, it's just like 20 million people. And 40% of those 20 million people do not earn enough money to buy organic food. You know? I mean, it's just like economic justice really matters. And when you look at natural health, I mean, why don't poor people have access to information about natural health and natural health products? You know? It's like, why? You know, and why do we get these huge health movements in America? Two of them. We got the natural health movement, which I'm proud to be part of. But we got this other weird thing called the single payer movement, right? And these people, it's like parallel universes, because I've tried to get them together. Leaders of the nurses unions, Jill Stein, you know, she's a pediatrician running for president in the Green Party. These people, the single issue healthcare people, which is, it's just universal healthcare. You know, they're too wimpy to say that, so they call it single payer. I mean, single payer, that's like progressive. How would you ever think that that could mobilize, you know, people? But when you talk to them, what you find out is that they don't know a thing about natural health, you know. They don't know any kids who have been injured by vaccines, you know. And they're really concerned that poor people don't have access, you know, to hospitals and stuff without just, you know, having to go to the emergency room and all that. They think they've done a really good thing. And you ask them about Obamacare, you know, and they say, well, yeah, that's not what we wanted, but it's better than what we had. And then you ask the natural health people, we'd be better off with no health insurance compared to strapping people down so they can be, filled with pharmaceutical drugs and injected with vaccines and so on and so forth. But this parallel universe all those nurses, and I think even some of the doctors, you know, they actually think they're doing the right thing. But I don't know how we're going to solve this, but we're going to have to solve this, you know. And to me, I always say, well, what about universal health care with a preventive focus and the maximum use of alternative and holistic practices? What's wrong with that?
Yeah.
You know? It's just like, how come I get medical? I've never been to the doctor, by the way, in my whole life, except for a broken arm, a broken ankle, and an appendicitis. That's it. You know? And it was partly because I was, my first experiences with the medical profession, I think, those people with the white coats that I remember behind the lead curtain. It's just like, how come I pay $95 a month, you know, for full health care, you know, because I'm a senior citizen, and everyone else has to pay hundreds of dollars for crap, you know? Why is this? I mean, we could obviously have Medicare for all, but I don't think that's a good idea if that just means more pharmaceutical drugs and more vaccines and so on. However, we got to start talking like this at some point, because the natural health movement is often seen by low-income people and people of color as an elitist thing. You know, it really is. And that's what these nurses that I've tried to talk to about natural health, or these single-payer advocates, they think that the natural health movement doesn't care about poor people. They really think that, you know, because they say, well, you don't support, you know, these measures to make medical care accessible and so on and so forth. And it's like people who tell me the organic movement's an elitist thing, you know, it's just the middle class, it's just the people who can afford it. You know, it's like, well, there's a grain of truth to that, you know, unless, you know, it's like food stamps, right, for example. Half the people in the country who are eligible for food stamps don't get any, you know, and the people who get food stamps, they don't get very much money, and it's like mainly junk food that's available, you know. And we've had to fight like hell for people to be able to use food stamps to buy organic food. I mean, the WIC program, we had a long campaign because it was illegal for women in the WIC campaign, the Women, Infants, and Children's campaign, to buy organic food. And what the government told us over and over again was, well, you know, poor women, they're not really good at balancing their checkbooks, and, you know, if you let them buy organic food, they're gonna, you know, their children are gonna be malnourished. So, anyway, this economic justice thing, this is very important to our movements. Everyone needs to be able to afford access to information about natural health. Everyone needs to be able to afford the products that we need. Like I remember Dr. Mercola, when I first got to know him about 5 years ago, you know, we were talking about probiotics. And they have some really good probiotics. I mean, I take them every day. But Dr. Mercola said, you know, the problem with our probiotics is it costs like $40 a month for one person. You know? And they're not so expensive because we're trying to get rich and exploit people. These are high quality probiotics. They really work. But they spent years developing an alternative. You know, what they came up with was fermented vegetables are a heck of a lot better than the best probiotics. You know, and that if you eat you know, and sprouted grains, especially sunflowers. If you are a poor person, but the cornerstone of your diet is sprouted grains and fermented vegetables, you can afford the organic beans, you know, and, you know, the other complements of a really good diet, you know. And they believe that we need to phase out, you know, the supplements over time that can be better met by lower cost things, you know. And that we need to learn again those hippie skills that we had, you know, making the sprouts in your apartment, you know, making the fermented vegetables, the kombucha, all these things. But this is a question of what I would call natural health justice, you know. This has got to become right at the center. And if it was, I think it would be easier to reach those single payer people, you know, who don't know a thing about natural health, who think that we're anti-vaxxers and anti-science, anti-GMO, anti-whatever. They need to understand that, you know what, I care about poor people. You know, I mean, the reason I spend half my time organizing in Mexico is because I don't feel comfortable, you know, full-time in the organic movement in the United States. You know, I mean, we have 80 employees with Organic Consumers Association and Via Organica, but about 60 of them are Mexicanos, you know. And it's like, it's really interesting to work in an international organization where the majority of the people are not white and they're poor, you know, and they're facing really difficult situation, you know. And we have to win that respect, you know. And these other issues, like my number one issue, believe it or not, is the climate at this point. Food, farming, and the climate. Because I decided about 10 years ago, I really wanted to know. This was scaring me, what I was reading. And so I really became a scholar of global warming, you know, and climate chaos, what was causing it and how we can solve it, you know. And I fell into despair about this because, you know, no one wanted to hear about this. I started writing about this about 10 years ago. No one would read my articles. They want to read about Monsanto and pesticides and bovine growth hormone and, you know, they want to read about this. And so, but luckily I discovered that there's a solution to the climate crisis. And it's very simple. It's that Mother Nature, you know, has this thing called photosynthesis. What is photosynthesis? It sucks carbon dioxide out of the atmosphere, you know, in a liquid carbon form, sends a lot of it down through the plant into the roots where the little animals, you know, the microorganisms interact, you know, and create this incredible web of life. But we can solve the climate crisis. Yeah, we got to get to alternative energy is going to have to be the norm. I mean, like the big wind tower here is an example of that. But we can suck down all the carbon dioxide, the excess in the atmosphere, and put it back in the soil. And when you do that, it makes the soil more fertile, makes the food healthier, makes the animals healthier, makes the soil absorb rain instead of running off, you know, and it produces healthy animals, healthy grass, healthy food, healthy people, healthy small farm communities. So when you run up against someone who, you know, is trying to tell you that the climate is the most important issue, not health, not food, you know, try to learn to connect the dots, you know. the reason why people aren't rising up and solving these enormous environmental problems we have, like saving the pollinators. I mean, my God, over 30% of all of our food, it would not be there if it weren't for the bees, and we're killing off all the bees. You know, I mean, how dumb are we? You know? And we have to explain to people that we got to have a healthy population, mentally and physically, if we're going to deal with these problems. You know, if every other kid is born with a, you know, some kind of physical or health disability, the population is not going to be able to deal with this stuff. You know, it's just like we need to convince the climate people that we're fighting for a healthy Mother Earth too, you know, and that we're all going about it in different ways, you know. And so I'll wrap it up with that I think this country we have enough people who are still, you know, physically and mentally able to deal with this situation. But this is not our kids and our grandkids that are going to solve the problem. We don't have time. We are going to solve the problem. And that's it. And maybe we come back after we die this time. I mean, the little animals, you know, are ready to eat us up and turn us into another farm. Maybe we come back, maybe we don't. I'm not sure. I kind of think we do. But we got to solve the problem, and we got to solve it now. And I think we can do it. Thank you for everything you do. I didn't wear my beret tonight, which I often wear with a peace symbol on it, but I have this hat, which is Organic and Natural Health Association.
All right.
So I'd like to, this is a new trade association, because we're not going to save the world without businesses, you know, leading the way, I believe. So we need ethical businesses and public interest groups, like most of us represent, united, right? The Natural Products Association is sold out to Big Pharma, okay? The Organic Trade Association has sold out to Big Ag. Okay, so a year and a half ago, a group of us, Dr. Mercola, Organic Consumers Association, International Federation of Organic Agriculture Movements, and a bunch of natural health supplement companies and natural health companies formed a new type of trade association, which I would like to request that each and every one of you consider joining. You know, the dues are based on, you know, basically the size of your budget. They're not that it's not that difficult, but it's a way for ethical businesses and activist groups to sit down together as equals and come up with a plan that we can build the market share of organic and natural health, but do it in an ethical way. You know, and where the executives from some of these big natural health companies can look us right in the eye, the activists, and where we can have a good conversation. So look it up on the web, Organic and Natural Health Association, and please consider joining it. I mean, even though we're in our early stages, we are going to be the alternative to the Chamber of Commerce here, National Chamber of Commerce down the road. So thank you.